what a blepharoplasty surgery is. What is it indicated for? So let's break down a blepharoplasty when it comes to upper lids and lower lids. So upper lid blepharoplasty is a procedure where extra skin is removed in the upper eyelids, along with or without some extra fat that's prominent. So patients typically come and see me for removal of extra skin because they look constantly tired. That extra skin is heavy and it's weighing down on their lashes, and they're constantly trying to lift their forehead up, and they oftentimes get headaches because they're trying to do that. Oftentimes they're unable to see well. Their peripheral vision is actually blocked because the skin is hooded almost essentially over their lashes and creating this sort of effect like an umbrella where they're not able to see well out in the periphery. So these are all indications for having a blepharoplasty. Other patients just really want to have a little bit more eyelid show. They just want to have more ability to apply makeup, for instance, to enjoy that. And others just really desire to have less skin in that particular area so they can see more of their eyelid. So these are all indications or reasons for having a blepharoplasty. Now, the indication is something I'll decide on whether when I see the patient, are they a good candidate for surgery? There's oftentimes patients that really don't have extra skin, and I don't recommend an upper eyelid blepharoplasty. It's not the right time. But most patients that come and see me already have an idea of what a surgery like this would do. They've looked through my before and after galleries, they've done their research, and when they come in, they generally have a good idea of what a blepharoplasty would do for them. And so we talk about that in our exam process, and I'll determine whether they'll be a good candidate for having an upper eyelid blepharoplasty. So the lower lid blepharoplasty is essentially a procedure that usually focuses on more extra fat, prominent fat in the lower eyelids, where there's a bowl that's created with the 3 fat pockets that are present. There's usually a medial one here that's prominent and a central one. These two are the most common fat pockets that are present in patients that I see in my practice for lower lid blepharoplasty. And some of my patients also have a prominent lateral fat pocket all the way out here. The goal of a blepharoplasty surgery in these patients is to help remove that extra bump, to help improve that prolapsed fat, then also address the hollowing underneath. Most patients that have prominent lower eyelid fat pockets also have hollowing along the infraorbital rim. So what I like to do is utilize that extra fat at the same time of surgery and reposition a lot of it at the same time to improve the hollowing. So that's called fat repositioning. Patients that desire to have lower lid surgery constantly complain, similar to the upper eyelids, of feeling tired or looking tired, even though they've slept 8 hours. People are always commenting on why tired. People are complaining of darkness to their lower lids. Oftentimes, where there's a fat prolapse and a hollowing underneath, there's a shadow that's created that makes them look like they have dark circles. So lower lid blepharoplasty can certainly help in those cases. Patients can also have extra skin present at the same time as extra fat. And so at the same time of a lower lid blepharoplasty, a small strip of skin can be removed from the outside approach, and that's usually through a skin pinch is how I like to do it. So the approach to the lower eyelids is done through a transconjunctival approach usually. So that's a non-visible approach. It's done behind the eyelid, where I make a small incision that you'll never see, you'll never feel, you'll never know it's there. And that pocket allows for me to expose and visualize all the prominent fat pockets the patient has. And then I'll decide if I need to trim a little bit of the fat. And then once I've decided how much fat to trim, I'll then prepare a pocket, and it's through that same incision where I'm able to expose over the orbital rim in preparation for moving that extra fat down. And it's such a beautiful process where I get to visualize and move that fat and reposition it and secure it with these sutures that come out through the skin. And I tie it down over a little bolster padding, which stays on for a week. So the goal of that is to allow for that fat to stay in place during that first week, to be locked in place, to heal. And that bolster outside generally helps with the swelling, generally helps with keeping that lid in place, and they all come out in a week. So that's the beautiful part of the surgery. And if I were to add a skin pinch at the same time, that small incision is made just below the eyelashes.